Basically, a week after we told everyone, how excited we were that we're in Montana, we're having a child, it's fantastic. A week later, I'll never forget, I was driving, I answered the phone and I was like, hello, and there was nothing. And then I realized, like, Amy's bawling. Right then and there, she didn't even have to say anything, and I knew. Amy was just in the room, laying in the bed, and I just got in the bed and we just kind of hugged. And
getting a cancer diagnosis, you feel like your life is over. Like, I think for the first couple weeks, I'm trying to get everything situated for him.
Just so devastating. I think things from there started to move really quick, like really quick.
Triple-negative breast cancers are more aggressive, and so when we see those, we really feel some urgency about getting things going.
Amy's situation was unique in that she was 14 weeks pregnant when she was diagnosed with cancer, so that adds a whole nother level of complexity and more physicians needed to try to figure out the best course of treatment.
I just reverted to Google. In 2019, the search terms, triple-negative breast cancer, chemotherapy while pregnant. I didn't find a lot. I think one study from the UK, I was just trying to find something that would say, look, it's safe.
Pregnancy-associated breast cancer is rare, but it is encountered. My job is to make sure that each patient knows every single option that they have, because it is never black and white.
They gave us 3 options. The first option was to terminate the pregnancy and treat the cancer. Second option was to continue with the pregnancy through the 9 months and give birth and then start treatment, which she said would probably not turn out well for me. And then somewhere in the middle, so stay pregnant and do chemo while pregnant. We were definitely interested in that option, and we're leaning towards that option.
Those discussions started really happening when we met with Dr. Andreas. I remember questioning her like she was on a deposition, right? Like, so generally, would you say that, would it be fair to say that chemotherapy targets fast-growing cells and destroys them? She's like, exactly. You couldn't have a faster growing cell than a little human, and now we're talking about chemotherapy. Like, how can we even be having this conversation?
In her case, there was no perfect answer. We just had to get the best data and calmly make good decisions.
We're gonna do the full thing. We're gonna try to treat Amy and the baby, and we're just gonna hope for the best.
Once the baby was basically fully developed, they decided to go ahead and start to treat Amy.
I went over the specifics of how we manage patients with breast cancer in pregnancy. We scheduled her for ultrasounds to check the growth of the baby, and we initiated antenatal testing to assure that the baby's condition was normal.
As she moved through her pregnancy, she was also moving through her chemotherapy treatments. In her case, we gave it in a condensed fashion, which was to try to get her through her chemo by the time she was ready to deliver the baby. With a high-dose Taxol like she had, sometimes we'll see a lot of bone or joint pain.
So I don't know if it was my belly getting bigger and having so much weight on my feet, but anytime I stood up, it literally felt like my shin bones, it felt like they were literally gonna snap in half. That's how much pain I was in.
It's like 2 a.m. and Amy's just crying in pain. Let's just go to the ER. It's not like a bumpy road. But that night, every crack in the cement, every time a tire went over that, Amy would scream. She was in so much pain, just screaming. So we go to the ER, and again, it's the middle of the night. Immediately get in a room. The ER doctor, she's like, okay, so I've spoken to your care team. Oncologist says this, OB says this, so this is the plan that we can give you. The orchestration of this care is just incredible.
It's really important in these situations that all the different team members talk together.
Our ability here to communicate among the specialists is really good. Hopefully helped provide them with some more comfort.
We just knew the whole time We were in good hands. With all of the pain, there was the light at the end of the tunnel.
We needed kind of a lot of moving pieces to be together and to be on the same page when the baby came.
So that was kind of the tricky part, is trying to make sure she got all of the treatment in before she was due to deliver.
A month after I finished my last dose of chemo, we went in to have our baby boy.
On June 26th, Mikhail Mack was born. You know, I just remember holding him in the OB in the room and just looking at him. You're here? Grateful. Grateful.
So after Mikhail was born, our long-term plan was to have the double mastectomy, but going through all the chemo and then giving birth on top of that, my body couldn't handle that. So it was the lumpectomy first, 6 months of oral chemo, and then had the double mastectomy.
It takes a village to get a surgery the size of a double mastectomy with immediate reconstruction done.
So really, I think a lot of it has to do with our staff, just working together really great and, being familiar with how this works.
Having all the specialists that a patient needs in the cancer program at Logan Health Medical Center is so important. There are probably 36 other people that need to make one surgery happen, and we're proud to work with every single one of them.
Now Mikhail is just over 2 years old. He's crazy as ever. He's perfect. He's healthy.
He's acting really normal. He's a pretty busy guy, so they have their hands full.
We took every measure that we possibly could with the advice of the medical professionals that Logan Health has to offer. From diagnosis 2.5 years ago to reconstruction, finalization 2 weeks ago, I don't think we traveled more than a mile, and we had this all done with fantastic outcomes in Kalispell, Montana, at Logan Health.
Cancer care is the ultimate team sport. Amy was the captain of that team. We were just all glad to be her supporting players.
She's the hero of the story. I mean, she really did, everything she could do for her baby.